Hi, I'm Shane Bales, Doc Hockey for Pro Action Sports Injury Clinic. We're having some fun today with pails and rails, all right? Even with my socks. Look at the toes. Bright, right? We like brights in here. As you can see, our walls are green and bright, all right? So have a bright day. Okay, anyway, so we're doing ankle capsule stretch into eversion or external rotation, so basically outward movement of the ankle mortise joint. All right, so I'm gonna show you how to do this. So we're just gonna sit down here, the bent knee. All right, so what we're trying to do is create external rotation or eversion. So that's basically when the foot kind of comes up and goes outside part here. So we're going to use our outside hand to come across. The inside hand actually blocks the tibia here, okay, or the shin bone. So we're doing that because we want the movement to happen at the ankle and not at the knee. Okay, so we block that down through here and we bring it out here. So we do our passive stretch, as you guys are probably familiar with a little bit, for their diaphragmatic breathing in here, and we're bringing the foot outwards, okay? As we do that for 2 minutes, then we go into our pails contraction, which is basically going against the resistance of the hands. So the foot's going to be coming inwards, and we're going to be trying to move that without actually moving the joint. So we're just putting the resistance against there, okay? And we're holding that there for 2 minutes, and we're bracing throughout the body. We want to make sure we're bracing so that the tension goes into the joint and creates more strength and tension, so the joint is aware, as well as it can be increase in strength, okay? So we hold it there for 2 minutes then, right? And then we actively are pushing back outwards the same way we came, so the external rotation or the outward rotation there. So we're actually trying to lift the toes up and the outside part of the foot up and bring it downwards that way, actively with the muscles. You might feel some tension into the shin bone here and through the upper part of the muscles and the outside part of the foot there. And we're doing that for 10 to 15 seconds. And you can have different variations of contraction with that. So your max contraction might be 50 to 80%, depending on what the practitioner thinks is a good idea for you or what your progression should be at this point. All right, then we're going to repeat that again. We're going to go back to our passive stretch, diaphragmatic breathing, open up through here. All right, breathe. All right, we do that for the 2 minutes. Then we go back into the resistance against the hands. The foot's coming back inwards, holding. All right, we do that for 2 minutes. All right, with our bracing through our abs and our legs, everything's being contracted. It's like an automatic contraction, so it's like an exercise. And then we go for the foot going outwards again and trying to close this angle through here. So we're doing it as best as we can to create increased range of motion and muscle contraction through here. All right, we're going to do that 2 to 3 sets, and each time you should get a little bit more range of motion when you're doing it. Once the range of motion stops, then obviously that exercise for that segment of the day is complete. And you can do it again multiple times during the day, but at this point, that's what it kind of stops at. So if we can look at this, okay? So we did ankle capsule stretch for eversion or external rotation, so outward rotation of the ankle. That's what we're focusing on, not the knee rotation. And then we have a passive stretch for 2 minutes with external rotation or outward rotation of the ankle. All right, that's their diaphragmatic breathing. Then we have a resistance contraction, which is basically going the opposite way into internal rotation or inversion, where the foot is coming inwards. All right, we're holding that for 2 minutes. All right, and we have that bracing throughout the body to create extra tension through the joint. Then we have our rails contraction, which is active rotation into the range of motion that we want, which is external and eversion, so outward rotation of the ankle. All right, we're doing that with a pretty strong contraction, and we hold that there. And then we have sets 2 to 3 to increase range of motion each time, and once that's complete, then you're done with that. So after you're done these are not just like normal stretches. You actually feel a little bit tired and maybe a little bit exhausted just from actually doing muscle contraction throughout the whole body. So I hope that helps out with your at-home programs. So if you have to do this, you can increase that range of motion to help with ankle pain, knee pain, and so on and so forth. And make sure you're doing it the best you can. And if you have any questions, please give us a call or ask your practitioner at this time. So thank you very much. I'm Shane Bales, Doc Hockey. Have a great day.